morning. I'm Dr. Jessica Saepoff. You're listening to Dental MD on KKNW 1150 AM Alternative Talk. They did not ask me to do that little plug, but I'm very proud to be on this radio station. This is a rare opportunity. There are not that many radio stations like this one, and I'm sure that if you've been hopping around on this station listening to various shows that you understand that, you're going to hear stuff that you would not otherwise get to hear about. So that holds true for this show, where I talk about various aspects of dentistry or dentistry itself in general and how it can be accomplished in a way that is more along the lines of the philosophy of natural medicine. And you really aren't going to hear a whole lot about that. You might hear some catchwords. You might end up in an office that does one thing but not other things. Maybe they don't use fluoride, but they're still putting mercury amalgams in people's teeth. Maybe they don't use mercury anymore, but they're not necessarily careful when they drill it out to prevent exposure to you, the patient. And, of course, the indoor office air and everybody that's in the office all day breathing that. There are a lot of different things to know about practicing holistic and natural dentistry. And one of them, when you go online and do a search, there are a lot of different terms that you can put into your search and find different things. I mean, when you go online and do a search, what you ask, the way you ask it, and maybe even what you're intending while you're typing that in, if you want to be esoteric about it, intentional, that is what's going to have an impact on what comes back as your answers. But there are more and more, algorithms and AI that are out there trying to steer you toward certain information. When you ask certain things, it says, aha, we're going to send them, this as their group of answers, search results. And it's getting a little bit more heavy-handed and a little bit more obvious, because you can type in an exact domain name and it'll, instead of taking you to that domain or that website, it'll give you search responses that are similar or not quite what you asked for. So, but there are different search engines. Everybody doesn't have to use the same one, and there are some out there that might be more, I should say less influenced by AI algorithms to steer you to the approved search results. So, yeah, just be aware of that. But some of the search terms that you can use are natural, holistic, biological, integrative, complementary. Those are different terms that have been used to refer to the practice of dentistry, which is aligned with natural medicine. And medicine also, if you look for natural medicine, you also want to use all those same kinds of search words to get the information more tuned to what you're asking about. All right, so natural medicine is essentially medicine that is practiced according to certain principles, which include using the least toxic methods and least invasive methods possible for that situation in that moment. Obviously, if something is acute or life-threatening, the appropriate thing is something faster and possibly more invasive, maybe more toxic than starting with an herb or whatever. But if your situation is acute or urgent, you don't start with something, and see how it works and then try the next thing. You jump in with something that is known, that is going to work, and you're not really as concerned about these other subtleties or side effects or after effects, because your point in that moment is to save a life or prevent a more acute development. So, having said that, the point of practicing according to the principles of natural medicine is to use the least toxic and least invasive methods and materials and procedures possible for that particular case or situation. So, the least toxic and the least invasive ways to do things are not necessarily the most lucrative. They do not necessarily cost as much. Sometimes they cost more, but most of the time it's less because it's you nudge the body to get it to do its own healing if possible, using things like homeopathy or herbal remedies or a little bit of a change in the diet. Eliminate this, add this. Certain supplements, well, those would be vitamins, minerals, or herbs and things like that, that help the body heal the thing on its own. Because after all, it's the body that does do the healing. But sometimes there are things that are in the way. Sometimes it is lacking something and it can't get on with the business of healing. Whatever it is, maybe it's a mental attitude, that needs to be considered. Everything needs to be looked at. That's the point of calling it holistic, is that you're looking at all the different possible factors that could be impeding the body's own ability to heal something. Now, once you're past that point where the body is not whole anymore, the problem has progressed. Now there's actual physical breakdown, not just symptoms, not just impending breakdown. There is actually rot or infection or broken or something has progressed to the point where functionality is impacted, such as, let's just keep it dental. You have an area of a tooth that has demineralized a little bit. That's the stage at which you can reverse it. You can give the body what it needs and remove something that's causing or promoting that demineralization. And then the body should be able to take over and correct a problem before it becomes irreversible. Then something, if it doesn't work, then something happens, or if nothing is done, then eventually the surface of the tooth becomes so weak and it's degraded underneath the surface where you can't see it deeply enough so that you go to bite into something and all of a sudden what looked like a whole tooth now has a giant hole, and that's because the surface broke through, caved in, and now it's a cavity, which is a hole. Cavity means hole. And now you have something that the body can't reverse anymore, and it needs an intervention, it needs a procedure. You can definitely get the decay process to stop, but you can't get the hole to fill back in. That's the problem. So an intervention where, the decay process is slowed or stopped, and the rotted part is physically removed and restored with a material that, and this is where, using the least toxic and least invasive methods, now that you have to do a procedure, you want to implement the principles of using the least toxic and least invasive methods. But unfortunately, you go into a dental office and they are running a business and they look at this hole in your tooth and they're thinking, what is the biggest and most expensive thing that I can do here that would be justifiable and which the insurance will help cover? Unfortunately, that is the mindset most of the time. And they want to help you and they want to treat your tooth, but they're not on the same page with you about wanting the least invasive thing. Because at that point, the least invasive thing is the thing that brings in the least money, and the most invasive thing is the thing that brings in the most money. There's a joke in dentistry that goes, the more tooth dust you create, the more money you make. And unfortunately, that does seem to be true. So it's not easy to run a business and do the least invasive treatment possible. But it is possible to do that. And the fact is that a lot of patients actually, that is what they want. Unless they're also looking to have something cosmetic done, which is fine. That can be done too. That's not necessarily the least invasive way, but if that's what a preference is in a particular case, if it's a front tooth or a tooth that shows, then you do the least invasive and the most cosmetic result that you can get with the least trauma. And that sometimes means working more slowly. It sometimes means doing it in 2 stages. It sometimes means doing, let's say, a veneer or an onlay instead of a crown, that kind of thing. Just, less drilling means less trauma. But, and going slower also means less trauma. So, but of course, the other old saying is time is money. And so the faster a dental office can get things done, the more efficient they can be, the more money they make. So that's just unfortunately true still. And, you want to try to seek out an office that, sometimes they talk a good game and then do things their way after they've talked about doing it your way. And as a patient coming into an office, there's really not a whole lot you can do. You may not even know that it was not done the way you had discussed wanting it done. So, yeah, it's important to use your own radar. And, you're kind of left with that. That's all there is left to use, because there's so much that you can't know, and you don't always know whether people are being honest with you. And the same way that you think if you ask a question into a search engine that what you ask for, that the search engine is going to go all over the World Wide Web and find you the most exact answers to your question. And unfortunately, it just doesn't work like that. So you have to interview different offices, call up, ask questions, get a feel for what that office is like before you make an appointment. All right, you are listening to Dental MD. I'm Dr. Jessica Saepoff, and if you have questions about anything that I'm talking about today or in archived shows, check out the archives. Give us a call, 425-427-8899, or you can reach the front desk by email, appointments@naturaldentist.com, to ask questions or make appointments. All right, I'll be right back after this break.
Did you know as many as 15 million Americans have been diagnosed with COPD, chronic obstructive pulmonary disease? Sadly, COPD is the 3rd most common cause of death in the United States. Hi, I'm Representative Cindy Rhea from Washington. As many as 12 million adults may have COPD and not know it. COPD could include wheezing, cough, chest tightness, and shortness of breath, and it can vary from day to day. COPD is a disease that can worsen over time, and patients may experience flare-ups. Flare-ups can increase shortness of breath and uncontrollable coughing and may lead to hospitalization or even death. While COPD is not curable, there are treatments available to help you breathe better and prevent flare-ups. If you or a loved one has COPD, please talk with your doctor to create an action plan that fits your lifestyle. For more information, please visit womeningovernment.org.
So how long has it been since you've been to the dentist? Yeah, I'm talking to you. I know going to the dentist can be tough, but did you know that healthy teeth lead to a healthy body? I know what you're thinking. All dentists are alike. They lure you in for the free exam or, complimentary cleaning. And before you know it, wham! Huge dental bill. And did you even need all that work? Well, why not try a different approach? Natural Dental Health Associates in Issaquah specializes in taking care of you. Their easy, no gimmick, honest approach to dentistry will have you forgetting you're actually in a dentist's office. And the best thing is, they're all natural. Yep, no mercury, nickel, or other harmful chemicals are used. Click on your media player now and get started on the road to better dental health today. Or call 425-427-8899. Natural Dental Health Associates is a proud sponsor of the Dental MD radio show, Wednesdays at 9 a.m. on Alternative Talk, 1150 a.m.
Get inspired every hour right here on Alternative Talk 1150.
Welcome back. You're listening to Dental MD. I'm Dr. Jessica Saepoff. Today I'm talking about holistic and natural dentistry, just in general, because you are searching for care that meets your needs and preferences. And not only do you need to know what to ask for and how to ask for it, but you need to know whether the answers that come back to you, whether it's in a phone call to an office or on a search engine, you need to know whether those answers are ringing true and are really compatible with what you are asking for and what you want, what you prefer for yourself and your family. So it's tricky out there. It is really tricky, and I mean tricky. It's hard to know. You're going to, why should you as a patient have to know so much about health and medicine and dentistry and law and just, anything that you get faced with? If you're not a professional in that area, you are like a lamb. It is just, people will take advantage of you. They know that you are not at the same level of expertise or knowledge. You really have to be your own advocate, or you have to know somebody that can interpret what you're being told and help you understand so that you can make choices. Because making informed choices, you may be told that you have now received all the information you need to make the choice, but was it really? Maybe it's just all the information that that office needed to give you in order to be able to legally say they gave you all your options, or enough options, or the options that matter, or whatever their, limitation on that is. You either have to be educated in all these areas, or you have to know people or hire people to look at things for you. And hiring professionals to look at every little thing and help you so that you can make choices that are intelligent, that's very expensive. Nobody can afford to hire a professional. I mean, of course, there are people who can, but most people, I should say, cannot afford to hire a professional every time they're faced with any kind of decision. It's not realistic. You don't always have time to do that either. But if it's not urgent and you do have time, then definitely seek out some expert opinion and see if you can get some assistance discerning whether what you're hearing is what you need and want, and what you're being offered is what you need and want, and also that what you're being offered as a treatment choice is really, that you're being offered all of the available appropriate choices, not just the ones that that office is going to make the most money doing, or that perhaps what they're offering is the thing that that practitioner would want if they were in your shoes, or it's what they would talk their own family into getting. That's a really common one. Oh, if you were my mother or sister, this is what I would tell you to do. Right. Okay. I don't know. I've heard that numerous times. You probably have too. But when you get down to the bottom of it, it really is that you're being offered the things that make that office the most money, or the things that that practitioner thinks are the best options that he'd want or he or she would want. And that is not actually, in my opinion, the way the golden rule is supposed to work. Do unto others as you would have them do unto you. Just because you might want an implant instead of a partial, that doesn't mean that you talk everybody into that because that's what you'd prefer. The way I apply the golden rule is that what I would want is to be given all of the information that's relevant, not picked and chosen by, just I want all of the information that's relevant, even if it's not the thing that's going to make that office the most money. I want all the information that's relevant, and I want to know what all of my treatment options are and what has to be done in order for me to have those options and what the long-term impact is of each of those. And I want the truth. And then I want to be given time to look all those things up, do some of my own research if I want to, get second opinions if I want to, take my time reaching my own conclusion and decision about what my choice is going to be. I don't think that's what most dental offices give you. But that's what I would want, and that's what I give people, because that enables it. It's empowering to people to be given freedom in the form of information, true informed consent, and freedom to take their time and seek out other opinions, do their own research, get other points of view, talk to family members who have been in that situation, whatever it is that a person needs or wants to do in order to feel comfortable with the choice that they are making for themselves or their children or a family member. And taking your time to come to a decision that is not what most offices want you to do, because they want you to, the name of the game when they hand you a treatment plan is they actually go to courses to learn how to close sales. You know what that means? That means you are not given an opportunity to take your time, because closing a sale means we need you to sign today on the dotted line. Everything is so urgent, and if you don't hurry up and make a decision and make an appointment before you leave today, then you're, fill in the blank. You're neglectful. I mean, if it's your child that you want to take your time figuring out what to do, then, maybe you get the feeling they think you're being neglectful of your child because you're not jumping right on it and getting that treatment done ASAP. Or if it's your own mouth and teeth, then, you're just not being responsible and not taking care of yourself, and don't you care about yourself, and why are you hesitating, and why are you going to wait? And no, you're not waiting. You're going to do some research and come to a decision about how you want it done, what you want done, and when you want it done. And you should be granted, in my opinion, the freedom to come to those choices in your own time after your own process, unless it's urgent, unless it's really urgent. But these courses teach dentists to tell you, the patient, why a thing is urgent and all of the terrible things that will happen if you wait. And it's true, if you have a situation that is precarious or unstable or is currently worsening and it has not been stabilized and you haven't been able to reverse the process of breakdown yet, yes, if nothing is done and you continue on that same path, things will continue to break down. But, the point of the the people trying to get you to make that decision on the spot, is you should be afraid, very afraid of quick, rapid, disastrous doom and gloom breakdown. So if you're being given that kind of a scenario and you feel kind of pressured to sign and make an appointment and come in and have the procedure done that doctor has told you is the very best thing, and it's what he'd want, and it's what he'd want for his own mother and all that stuff. If you're feeling kind of pushed into something, you need to just stop and honor your own internal meter that tells you that, because you're going to look back at it later and you're going to say, why did I go along with that? You look back at it later and you say, I knew, that little voice said, wait, don't do it yet. And I did it anyway. They just, the person in the white coat standing there telling me I had to do it right now. Quick, soon, do it right away, or else disaster. And the little voice that's saying, wait, don't do it yet. Do some more research. Take your time. Are you going to listen to that little voice? Maybe the little voice is saying, yeah, this sounds good. I'm happy. I'm comfortable with this. I think this makes sense. Go ahead. If that's what your little voice is saying, great. Go ahead and feel comfortable and don't have regrets. But when you're being faced with any kind of decision, check in with that little voice, check in with your gut, check in with your instincts. And if there are any misgivings, if your little voices are having a little argument in the back of your head, then just hold off, sleep on it, give it 24 hours, think about what you want to do. That's empowering. That's empowering to you. Empower yourself. Give yourself permission to listen to all the little voices going on in your head and really come to a conclusion and decision and choice that you are comfortable with. Never mind what people are saying, especially the people in the white coats. I mean, you listen to them the same way you would anybody, and listen to your own voices and, do what you find is comfortable for you. You are listening to Dental MD. I'm Dr. Jessica Saepoff. If you have questions about anything that I'm talking about, please give us a call, 425-427-8899, and you can reach the front desk with questions or to make an appointment. Appointments@naturaldentist.com. All right, I'll be right back after this break.
Well, it ain't no use to sit and wonder why, baby, if you don't know by now. It ain't no use to sit and wonder why. Don't matter anyhow.
I'm Dr. Anthony Lazarowitz, and this is Climate Connections. As the climate warms, many architects are concerned about more than aesthetics. Buildings consume nearly 40% of the energy used in the U.S. each year.
So getting the carbon footprint of the building sector down soon is a really important goal.
Carl Elefante was the 2018 president of the American Institute of Architects. He says design can make a big difference.
Part of it is making them tight buildings, making them so that the weather stays on the outside. Part of it is really making them so that every energy consuming system they have is more and more efficient. And then, of course, we've really gotten to be creative with including renewable energy in building design.
Through its 2030 commitment program, the American Institute of Architects encourages firms to make all of their new buildings and major renovations carbon neutral by the year 2030. So far, more than 500 firms have signed on.
For architects, I think it's really an opportunity. We love doing meaningful work and really showing that great design and great performance really add to each other.
And to a healthier climate. Climate Connections is produced by the Yale Center for Environmental Communication. Learn more at yaleclimateconnections.org.
Alternative Talk 1150 is your sports organization's safe bet when it comes to airing your team's games. Our players are all seasoned professionals when it comes to sports programming. Imagine your games being heard on local radio. Your team deserves the MVP treatment. Call 425-653-1150 today to learn how affordable and fun it is to broadcast your games on the radio. Call 425-653-1150 and make your next season something special. That's 425-653-1150.
Going our own way every day. Alternative Talk 1150.
Look out your window and I'll be gone. You're the reason I'm traveling on, but don't think twice, it's all right.
All right, welcome back. You're listening to Dental MD. I'm Dr. Jessica Saepoff. Today I'm talking about holistic dentistry, and there is more to holistic or natural dentistry, also known as complementary, integrative, and biological. I like to just kind of throw that in there because when you're doing searches, it helps to have, more ways to describe something, and the way you ask and what you ask, and all of those things affect the search results. So just keep asking things in different ways until you get the results that match what you're looking for. So it's not just about what we do, what of what we do in terms of less invasive or what procedures we do, whether it's a filling, an onlay, a crown, a veneer, braces, extractions, root canals or not, and the type of materials that are used. Those are the what. But how we do it, why we do it, when we do it, and where we do it are also important aspects to why is it holistic and not conventional or natural, based on natural medicine rather than conventional ways of doing things. Because the way we think about what we're doing and the reason why we do what we do and don't do what we don't do affects what you are offered and affects how everything is done and the long-term results. So how we do things, well, back to the what. The what is, is it a filling? Isn't it a filling? What are we removing? All of those things come with, well, not the what we're removing, but the what we're doing, whether it's a crown or a filling or braces or whatever. All of those things are common in every single dental office, and the coding and insurance codes for those procedures is the same no matter what dental office you go into. So a filling is a filling if it's 2-surface, 3-surface, tooth-colored materials, whatever it is, those have standard codes that are used to report the what of what we did so that it has a particular fee and a code and a reimbursement and whatever. So how we do those things is where the differences lie, and also why and when and where. So the how, I talked about a little bit already, doing things a little bit more slowly, doing things more gently. Those are important to the long-term health of the nerve and your long-term psychological happiness and health, because obviously how we do things is where post-traumatic stress lives. And a lot of people have that. A lot of people have post-traumatic stress because rather than, you're sitting in the dental chair, do you feel that the dentist is doing something for you and with you? Is that how that feels? Because that registers as, you're a participant, you're at choice the whole time. The dentist is doing something that you've agreed to do with that dentist is doing something for you that you've asked to have done in that way and on that day. No post-traumatic stress if that's the case. But if you have had the experience of being in the dental chair and feeling like something is being done to you or on you, that is going to register differently in your nervous system. And recovery from that, from feeling like something has been done to you, even if it's being done to one of your teeth, and you can see that as something separate from you, which it isn't, your nervous system registers this, and the next time somebody leans in with some dental instruments, your entire nervous system, even if you're overruling it with your present consciousness and saying, things are okay, it's okay, this is okay, I said it's okay, just relax, let this person do these things. They're fixing something. No matter how you justify it to yourself, if you have ever in your life, especially as a child, had the experience of feeling like something was being done to you and you were not exactly willing or permitting in that moment, emotionally or otherwise, that's what's going to really be your experience. No matter how nice the next dentist is, your experience in the chair is that you're basically emotionally reliving that earlier uncomfortable experience. How we do things is critical to your experience as a patient. And, there's a reason why sedation is so popular now. A lot of people already have post-traumatic stress from previous dental visits. If you get nervous, clammy hands, feel like you're going to break into a sweat at the idea of anesthesia, like local anesthesia, or the sound of the drill, or the sound of the instruments as your teeth are being cleaned, any of those things, even just sitting in the chair and nothing's been done yet, is your heart rate up? Is your blood pressure up? Are you feeling like you're not breathing deeply? You should be just as relaxed in the dental chair as you are when you're doing yoga. Really, it's possible. And it's possible without drugs. But most people, in order to achieve that tranquil state, need tranquilizers. It's very unfortunate. And, dentists have caught on. They're trying to do things less painfully and less stressfully for you. Unfortunately, most of the time, the effort to make things less stressful for you includes drugs, includes pharmaceutical interventions like tranquilizers. So, is it possible to do things in a way, like when I'm about to do a procedure, I check in with you, the patient, and make sure that you are not, and if you are in a slight post-traumatic stress memory, even if you don't really remember it, if you're feeling anxious, there's a memory there. Even if you're not conscious of what exactly happened, you might have been too young to remember it, or you might have blocked it out, whatever. And I'm going to want to know as much as I possibly can about what you're experiencing. And what triggers that feeling in you of not being tranquil and relaxed and happy. As soon as I find out what kinds of things are triggering that for you, I am going to set about finding a different way to do the thing that we're going to do that is unfamiliar to your knowledge system and memory. Sounds different, feels different, smells different, whatever it is, it's going to be hopefully different enough so that it doesn't trigger you. That I have a lot of different ways I can do things. And so why do it? I'm not going to do it the way that's easier and faster for me if it's triggering you. If I can do something more gradually or differently or use a different instrument or do it, a different way, whatever it is, even if it takes a little bit longer to do it like that, I would rather do that for you than offer you a drug. Now, I don't mind offering the tranquilizers, and if people want that, that's fine. We can do that, and I don't mind doing that. And, the goal hopefully is to reduce the need for that gradually as you can. Because, and it's okay if you always need some Valium to have any kind of dental work done. No big deal. It's not harming you. You'll recover from it. But ideally, you wouldn't need it, or you would need it less and less, or you would become confident in the way I'm doing things so that you are able to stay relaxed and you know exactly what to expect. You know it isn't going to trigger you. And then we can proceed, and maybe you don't need the nitrous or the Valium. But it's really okay if you do still need that. I'm not saying that there's anything wrong with it. It's perfectly appropriate if you're having a stress reaction. Definitely take something to make yourself feel, an approved pharmaceutical intervention so that you can sit in the dental chair without having an anxiety attack of any level, definitely. And so how we do things does impact your experience, and that's an important part of what we do. All right, we're coming up on a break. I'm going to talk more about why and when we do what we do, and how those things can vary from one practitioner to another and be different from conventional and holistic or natural ways to practice. All right, if you have questions about today's show or any of my archived shows, please see the archives and give us a call, 425-427-8899. And you can reach the front desk by email, appointments@naturaldentist.com, to ask questions or make an appointment. All right, I'll be right back after this break.
When Joseph was an old man was he. He married Virgin Mary, the Queen of Galilee. He married Virgin Mary, the Queen.
So how long has it been since you've been to the dentist? Yeah, I'm talking to you. I know going to the dentist can be tough, but did you know that healthy teeth lead to a healthy body? I know what you're thinking. All dentists are alike. They lure you in for the free exam or, complimentary cleaning. And before you know it, wham! Huge dental bill. And did you even need all that work? Well, why not try a different approach? Natural Dental Health Associates in Issaquah specializes in taking care of you. Their easy, no gimmick, honest approach to dentistry will have you forgetting you're actually in a dentist's office. And the best thing is, they're all natural. Yep, no mercury, nickel, or other harmful chemicals are used. Click on your media player now and get started on the road to better dental health today. Or call 425-427-8899. Natural Dental Health Associates is a proud sponsor of the Dental MD radio show, Wednesdays at 9 a.m. on Alternative Talk, 1150 a.m.
1 in 3 adults has prediabetes. 1 in 3. That means it could be you, your football buddy, your football buddy, or you, your best man, your worst man, you, your dog walker, your cat jogger. While 1 in 3 adults has prediabetes, with early diagnosis, prediabetes can be reversed. Take the risk test at doihaveprediabetes.org. That's doihaveprediabetes.org.
Wait, did they just say 1 in 3 adults has prediabetes? That's 33.33333% of adults. That means it could be me, my boss, or my boss's boss, or me, my favorite sister, or my other sister. That's 7 members of my 21-person romantic book club. Wait, the 1 in 3 could be me, my karaoke partner Carol, or my karaoke enemy Jeff. I'm gonna take the risk test at doihaveprediabetes.org.
Brought to you by the Ad Council and its Prediabetes Awareness Partners.
Alternative Talk 1150. It's good for what ails you. This statement has not been evaluated by the FDA.
I will twine with my mingles of raven black hair, with the roses so red and the lilies so fair.
All right, welcome back. You're listening to Dental MD. I'm Dr. Jessica Saepoff, and I'm talking about holistic practice of dentistry today, and that it's according to the principles of natural medicine. So the least toxic and least invasive materials and methods should be used first, and then, given the situation and the urgency level. All right. So what we as holistic practitioners do, whether it's a filling or a crown, and how we do it, how we approach you, the patient, how we approach the tooth, the speed, the materials, the instruments used, all of those ways of doing the what can impact what your experience is as a patient. But in most offices, the what and the how are selected by the office according to what is going to be the most lucrative and take the least amount of time and bring in the most money per hour that can be done. And in a lot of offices, the staff is also rooting for you getting the most stuff done in the least amount of time and the most lucrative stuff chosen rather than, plan B or C, these, less expensive plans that are not as good as the plan A, right, according to them. And the reason they're all rooting for that is because they may be paid a bonus at the end of the month based on how much money is brought in. So that's how practices get everybody on board with basically talking you into stuff, ultimately. So when an office offers sedation to you, it is not only so that you can have a comfortable experience, it is also so that they can get as much done in as short a period of time as possible. When you're sedated, you're going to be like, I don't want to have to do this again. Get my whole mouth done. Just everything that's on my treatment, just do all of it, and just wake me up when it's over. And that's what they're hoping for. The more they can do in the least amount of time, that is what every business is trying to do. Unless their number one principle is to do the least toxic and least invasive methods and materials possible. And really I'm not kidding when I tell you that is contrary to the goal of maximizing profits. It is. It's contrary. It is contrary. However, it works itself out because the natural medicine philosophy, once people understand this, they actually prefer that to, the more aggressive approaches. And you might want to get in and out in an hour and have everything running on time. You walk in there and they're ready to seat you right away, and it only takes exactly an hour, just like they said, and then they're wrapped up and you're closed up and done, and you're at the front desk and out, and it's inside of one exact hour. Is that what's important to you? If that is more important to you than whether your tooth is traumatized and ends up needing a root canal next month because it hurts, it's sensitive, and it just keeps getting more and more sensitive and doesn't seem to be improving. So, that is typically what will happen with teeth if the procedure is traumatic, done too quickly, done too aggressively. If finishing in an hour is more important to that dentist than whether your tooth is traumatized, you could end up with a tooth that is sensitive for months. And if your tooth is sensitive, and that can happen even with the most gentle techniques. I don't want to imply that the only reason teeth are sensitive is because it was done too fast or whatever. or too aggressively. That's a common reason for prolonged post-operative sensitivity. But you could walk into an office and have a tooth worked on gently and, with all of the care and attention to not traumatizing you or your tooth, and you could still end up with a sensitive tooth. It does happen sometimes. It depends on the tooth. It depends on the nerve, the condition of the nerve in the tooth at the time the procedure is done. Sometimes the nerve is in a little bit of trouble already when the procedure is begun. And if the procedure is done gently, the nerve could still recover. But if it's not done gently, then the nerve could still recover, or it could get worse. It's a case by case. I'm just talking averages. On average, more drilling and more trauma do lead to more root canals and or tooth loss. So the how it's done is very important. But if that's, if you're in an office where their being on time is more important to them than you and your teeth, then you need to check in with that little voice and say, does this match what I want? If it's yes, because I need to get back to work, and if I need a root canal, so what? And, if that's how you feel about it and you would rather have your day be like clockwork as well, then that is the right office. And your little inner voice is going to say, yeah, this sounds good to me. Go ahead, quick, get it done. Let me out of here so I can get back to work. Okay, fine. That's probably a majority of people, really. And that's fine if that's, the care that you choose, because it's about you choosing care that works for you, that is according to what's important to you. That's your right to choose whichever kind of care matches your lifestyle and your preferences. But for people who would rather not put their teeth at risk for possible root canals, either because root canals are expensive, that's some people's reason. Another reason would be because they don't want dead teeth. That's another reason. Or because they don't want to sit in another dental chair and have another procedure that may be uncomfortable. That's another reason not to want a root canal. But, for whatever reason, if the treatment is done gently and with as little trauma to you and your teeth as possible, your chances of having to have a secondary procedure on a tooth are reduced, just on average. That's all I'm saying. So the why of doing particular procedures, like let's say you have a tooth that's sensitive and it's been on and off sensitive. A lot of times an invasive procedure will be recommended to get you out of pain. That sounds good on the surface. Let's get you out of pain. Sure. Great. Yes, get me out of pain. Well, were there any other ways to get you out of pain, such as, doing things for the tooth that help the nerve calm down, that maybe aren't as invasive? Those will certainly be most likely less lucrative, less profitable for the business. Like just if you have teeth that are cold sensitive, could you maybe just get a night guard and see if your teeth calm down? Maybe the sensitivity is because of clenching and grinding. Or maybe somebody looks in there and says, oh, we better crown a lot of these. Your sensitivity could be because of all these cracks in your teeth. So maybe we should just crown all these old, old molars with big fillings. Let's just do crowns on those. That is a very highly profitable and invasive way to solve the problem, and may not even solve it, but might. So these are choices that are made, based on your situation and the preferences of the office and what they'd like to do or what they prefer to do. So, as I've said in this show a couple of times before, check in with that little voice. Don't just listen to the voice that's coming from outside your head. check in with the one that's inside your head. And part of, one of your little voices is nodding and agreeing because the sales pitch you're getting has gotten you nodding and agreeing, and they say things that make sense, and you say, yes, that sounds true, yes, that sounds true, and then they say, okay, crowns, and you've said yes 6 times already. The psychology of this is that you're going to say yes when they say the 7th thing, or whatever, 3 things, the 4th thing, 2 things, the 3rd thing. Whatever it is, there's a pattern, there's a way to get you yesing. And these techniques of sales and closing sales are taught to dentists as though what we are doing is sales and commissions and, all that stuff, closing a sale. That is, I have to say I'm kind of old-fashioned. I understand that that's like the way business is, but as a healthcare practitioner, my way is about, your health and about just doing the minimum thing necessary in the most minimal way to nudge your body to do its own healing. And what I do is a service. It's not a thing. It's not a commodity. It's not something you're buying. This is a service you're paying for, where I am assisting you in healing and then doing interventions only as necessary to allow healing and health. All right, you're listening to Dental MD. I'm Dr. Jessica Saepoff. If you have questions about today's show or any of the topics in my archived shows, give us a call, 425-427-8899, or you can reach the front desk by email to ask questions or make appointments. That email is appointments@naturaldentist.com. You've been listening to Dental MD. Thank you so much for being here and listening, and I'll be back next week.